Welcome to today's press briefing. We have two doctors with us today. Dr. Albert Au, Principal Medical and Health Officer, Communicable Disease Branch of CHP, and Dr. Lau Ka-hin, Chief Manager of Hospital Authority. The two doctors will give us an update of HA situation as well as COVID cases. Dr. Lau will have the floor. First, about HA situation. At the moment, we have 1,875 confirmed cases in our HA facilities. 273 of them are newly confirmed cases. For patients requiring isolation, 518 patients are in isolation wards, 141 in Tier 2 wards, and 601 patients in Hong Kong Infection Control Center of North Lantau Hospital. 214 of them are newly confirmed cases. As of yesterday, we reported 9 more patients in critical condition, 9 in serious condition, and for inpatients, at the moment, 32 are in critical condition and 33 in serious condition. 10 patients in critical condition are now receiving intensive care. For death cases, we've reported 4 more death cases, comprising 2 male and 2 female patients aged 52 to 96. 3 of them did not complete the 3-dose regime. So let me give you some information about these cases. First case, a 52-year-old female who did not have any COVID jab. She had liver cancer with metastasis to the lymph nodes, and on the 3rd of August, she arrived at the A&E unit with jaundice, fatigue, as well as abdominal distension. A PCR test was conducted, and the CT value was 19, so the patient was admitted to a hospital, and COVID oral drugs were prescribed, and treatment was provided in relation to her stomach distension and other conditions arising from the liver cancer. And she was transferred to the Haven of Hope Hospital on the 11th of August to further treat her liver cancer. And unfortunately, she passed away on the 16th. Second patient, a 69-year-old male patient. He had 2 COVID vaccine jabs, and this patient was the recipient of an organ transplant, and he also was in the process of chemotherapy because of lymph node cancer. And because of shortness of breath and fever for 2 consecutive days, he arrived at the A&E unit of the Prince of Wales Hospital on the 8th of August. He tested RT positive, and upon a PCR test further conducted, the CT value was found to be 15.7. The patient was admitted to hospital, and again, antiviral oral drugs were prescribed along with remdesivir. And because of the lymph node cancer, his condition continued to deteriorate, and he passed away on the 16th. The third patient, an 89-year-old male patient who had had 3 COVID jabs. He had prostate cancer, and on the 23rd of July, he attended our A&E unit because of fever, coughs, phlegm, as well as overall fatigue. And he tested RT positive on the day he arrived at A&E unit, and a PCR test was conducted with the CT value found to be 18.5. He was admitted to our hospital, and in fact he went to Tin Shui Wai Hospital and A&E unit, and on the 28th he was transferred to Tuen Mun Hospital for further treatment, but unfortunately he passed away yesterday. Last patient, a 96-year-old female patient. She had had 2 COVID jabs. This patient had underlying chronic conditions, including hypertension. She was short of breath and she had a fever, coughing, phlegm. On the 15th of August, she went to the A&E unit of the Prince of Wales Hospital, and the lung X-ray of the lungs were administered with OPG found. Then she was admitted to hospital, and her condition continued to deteriorate quite rapidly. And eventually, after being admitted on the 15th, she passed away in the hospital on the 16th. Next, we'd like to highlight one of the cases mentioned. This patient had a cancer. This patient was a cancer patient and never received any COVID jabs before. Many cancer patients had this belief that since I have cancer and I am frail, I should avoid receiving the COVID jab. But the fact is, this is exactly the contrary. Because of chemotherapy and because of the cancer condition, these patients have a very weak immune system, and that is why they should get vaccinated so that they can raise their immune level, so that if unfortunately the patient is infected with COVID, the patient's body will have enough immunity to fight COVID in order to minimize the risk of the condition turning severe or even passing away. So for elderly people who may have chronic illnesses and immunocompromised adults because of long-term medication suppressing the immune system, they should get vaccinated as soon as possible. As of yesterday, 206 patients recovered, including 172 who were discharged, and 4 patients were found to be infected upon hospital screening, admission screening, and 6 patients sharing the same ward are listed as close contacts. As for HA staff, we have 101 more staff members infected, and 36 more staff members have returned to their positions. And I'd like to talk about our elderly today. As you may see here in this chart, there is an increase in the number of cases in the community, and according to the Department of Health, 1/4 of all confirmed cases belong to the age group 60 or above. And for new admissions to hospital, the number of elderly patients have risen since June. And for this line in blue, it refers to the admission of new cases to our HA facilities every day. And in the beginning of June, or around early to mid-June, the daily caseload was 20, 30, or 30, 40. But then, as you can see in this upward trend, the number has continued to rise, so that as of yesterday, we recorded 172 elderly patients requiring treatment in our facility. As I mentioned, we recorded 273 new cases, and 60% of these cases are patients above the age of 60. And for inpatients, 80% are elderly patients above the age of 60. So take today as an example. We just announced 1,875 new COVID cases, and 1,501 of these are cases above the age of 60. Apart from elderly patients constituting the majority of inpatient cases, in fact, 80% of these cases belong to the belong to patients in critical or serious condition. As reported yesterday, among the 65 inpatient cases, 32 in critical condition and 33 in serious condition. And 53 among the 65 are elderly above 60. So that's 82%. As you can see, for elderly patients requiring getting infected, requiring hospitalization, and elderly patients in serious and critical condition, the percentage is on the high side, and there is a high demand for inpatient treatment. So we appeal to all elderly to get vaccinated as quickly as possible. They should complete the vaccine regime. I understand many elderly people have started to line up for jabs, but they should complete the regime as quickly as possible. And if necessary, please do the 4th jab as well, because for the time being, inoculation remains a very effective and helpful way to guard against severe cases and death cases.
And starting from April and May, we started having the antivirals. And once one is testing positive, one should seek medical attention as soon as possible, because the antivirals can control the disease. We have relaxed the threshold for those 60 and above. Even if there are no symptoms, even if they are not vaccinated, they can be prescribed the antivirals. They can make an appointment at the 7 designated clinics, or they can take advantage of the HA Go app to book the telemedicine service. The HA will make arrangement for courier companies to deliver the antivirals on the same day or the next day to the registered address. Other than the antivirals, the senior citizens should heed the medical advice and complete the entire course for 5 days. Some senior citizens might give up after the 2nd day or so. Now, our advice is they should seek medical attention. They should make an appointment for telemedicine. And some private practitioners also stock these antivirals. They should complete the entire course for the best possible effect. So the senior citizens should heed this advice in order to guard against the possibility of deterioration, and also to guard against hospitalization, which will impose a burden on the public sector system. Dr. Au. I'd like to say a little bit about the positive cases. On 16th of August, locally infected cases number stands at 5,563. 2167 came through the PCR test. 3396 came through the RAT verified by PCR. And also yesterday, 194 imported cases were reported. 173 through PCR, 21 through RAT. In terms of fatalities, Dr. Lau referred to the number. There are 4 additional deceased cases. As of now, since the 5th wave, we have registered 9,371 fatalities. Of the 194 imported cases, 89 were picked up at the airport, and 54 were picked up during the quarantine period at the quarantine hotels, and the remaining 51 were picked up at the community testing centers. 38 were picked up on day 4 to day 7 at the testing centers. So discounting the repositive cases, they take up about 20% of the imported cases. The remaining 23 cases were picked up after day 7. The CT value is over 30. They're mostly repositive cases. There are 194 cases coming from 43 countries. There are 5 countries that have more than 10 cases: Thailand, the UK, the US, India, the Philippines. For the remaining 38 countries, there are less than 10 or less than 10 imported cases. For care homes, there are 4 care homes that reported positive cases. There are 3 RCHEs involving 9 residents and 2 staff members. And the other one is an RCHD involving 1 resident. 94 residents are listed as close contacts, subject to quarantine. And they include the Fei Choi Home for the Elderly in Southern District. 7 residents and 2 staff members came down with COVID, and there were a high number of cases. There are 5 stories with 88 residents and 41 staff members. A registered nurse came down with COVID on August 15th. She had 4 shots last day at work, August 14th. Yesterday, another carer also tested COVID positive, no symptoms, with 3 shots. They worked at different floors of this center, 7 residents, and they include 3 cases that tested RAT positive, and 4 are reported today. 2 tested RAT positive this morning, and 2 are PCR positive this morning. They are asymptomatic for these 7 residents. 5 have had 3 or more shots, and the other ones, we're still waiting information that there is 1 on the 1st floor, 4 on the 2nd floor, 1 on the 4th floor, and another 1 on the 5th floor. As a precaution, we advise that all residents have to be sent to quarantine. There are 44 care homes. The reported cases over the past 7 days, 32 RCHEs and 12 RCHDs involving 72 cases, 57 residents and 15 cases involving staff members. For schools, this morning we have received 74 cases involving 48 schools. 38 schools are KG cum CCC, 4 primary and 6 secondary schools. Over the past 7 days, there are schools with more than 2 cases. The number stands at 14. Most of them are KG cum CCC. For the cases reported today, there are 4 schools that involve different classes that we saw some clusters. We have advised these classes to be suspended. The first one is in Guntong, the YMCA Tengginggu Kindergarten. Class K2, classroom 6, there are 2 students and 1 teacher who tested COVID positive. There are 15 students in this class. The second one is Sai Kong Yanyin Kindergarten, K1A, 11 pupils. There are 2 students testing positive. The third one is Victoria in Kowloon City International Kindergarten, K1 AM class. There are 19 students, 2 test COVID positive. The last one is in Kowloon City American International School Primary Branch. In the KG section, UCIP1, there are 4 students, 2 tested positive. At the lab test, 24.5% had tested positive to L452R. They are mostly BA.5 cases. And there are 7.4% and L54RQ, and they are mostly B.1.12.1 cases. As Dr. Lau said, there are senior citizens being admitted to hospitals. I'd like to add a little bit here regarding the elderly. I'd like to make some pleas here. We are concerned about the number of cases involving elderly, and it seems to be creeping up from August 1st to 14th. We have recorded 15,443 cases involving elderly citizens over the age of 60, and they take up 24.5% of the total number over that period. Compared with the past fortnight, July 18 to 31st, 12,898 cases, and the rate of increase is actually 20%.
For these elderly cases, we're talking about elderly people in the community, and those living in homes only accounted for a small percentage. For senior citizens above 60 years old, their number of cases in terms of the percentage vis-a-vis the total cases have increased comparing to the figure in early June. And in early June, cases above the age of 60 only accounted for 18%. Now it's close to 25%, 1/4 of all cases. In terms of infection among the elderly population, the fatality rate is also on the high side. For those above 60, without vaccination, if infected, the death rate is 8.63%. In other words, 1 in every 12 infected elderly could die. For those who have completed the 3 jabs above the age of 60, the death rate comes down to just 0.13%. So that's a 66 times difference. So for those senior citizens who haven't completed the vaccination regime, they should get vaccinated as quickly as possible. The Joint Scientific Committee also recommends those above the age of 50 to receive 4 shots. And for vaccination rate among the elderly population, much more is desired. And for the age group 60 to 69 who have completed 3 jabs, only 70%. And for the age group 70 to 79, 64%. And for those above 80 years old, only 44% have completed the 3-dose regime. So those who haven't get vaccinated should do so as quickly as possible. And if you have symptoms, you should seek medical help as quickly as possible and get tested. And if the result returns positive, you should report to the Center for Health Protection as quickly as possible. Because once an infected case is identified, the case information would be transferred via electronic means to the hospital authority for follow-up treatment. If necessary, antiviral drugs can be prescribed. You can declare your case via our online platform. And for elderly patients, if you are not sure how to make this report, you should seek help from your children or from other relatives. For others, if you have an elderly family member testing positive, you should try to help your parents and other elderly family members as much as possible. Help them make a report online, and elderly patients can also call 1-833-6119, and that's our hotline. This is an automated registration system, and once we receive information from you, our colleagues will ring you and help you go through registration as quickly as possible. And if you have an elderly family member above 70 years of age, if you're living together, they have a higher chance of getting infected. So if you do have an elderly at home, and if you test positive, you should try to go to an isolation facility to avoid spreading the virus. The floor is open. Please introduce the media outlet before you speak. This lady in green in the middle. Good afternoon, doctors. I am from Cable. First, about the number of patients hospitalized in the past 14 days. We see a leap in terms of the number of patients admitted to hospital. So what is your assessment of this upward trend? To what extent would the HA's services be severely impacted on? And if the upward trend continues, what is the HA's contingency and response plan? And about the 27-month-old toddler, we understand that his condition is now stable. But do you have the gene sequencing results? And what about the condition of the 5-year-old girl? And Dr. Ho Pak Leung has recommended that the 6-month waiving period should be scrapped, and that if you don't get vaccinated, you can't go into scheduled premises. And what is your take on this? Dr. Lau will explain HA's situation first. Let's refer to the chart just now. Starting from early July, we first identified an upward trend, and towards the end of July, in the past 2 weeks, the increase or the upward trend became more apparent. And our concern is that when we have more infections in the community, there would be a higher chance of elderly population getting infected. And as explained by Dr. Au, many elderly patients haven't received the third jab, and as a result, their condition could become worse very rapidly, requiring hospitalization. And if they don't get medical help in time and get prescribed with the proper drugs, there would be a high chance of severe cases and death cases. So we are making ready for more beds to be available to receive more patients. As mentioned a few days ago, we have kick-started the second phase of this bed deployment plan, and we actually today recorded 273 new cases. It's very close to the 300 threshold. When we register 300 such cases, we'll need to kickstart phase 3 of our plan, which means that if necessary, more patients will be received in our system for treatment. As for our contingency plan, we're talking about redeploying our resources to perhaps suspend non-emergency cases and services for non-urgent cases, endoscopy and other services, etc., so as to release more manpower and resources to serve COVID patients. As mentioned just now, 80% of patients in hospitals are above the age of 60. So if an elderly patient above 60 testing positive could make a report more quickly to get help and get the drugs more quickly, we can reduce the chance of their condition turning severe, requiring hospitalization, because the new antiviral COVID drugs could help address this situation. And as mentioned by Dr. Au, if the case particulars are uploaded to the Department of Health system, the particulars will be transmitted to the HA system, and according to the records, we will ring them. And basically, for those above 60 years of age, they will receive a call from us we will inquire about their condition, whether there is any discomfort, and whether a booking is needed. And we understand there are many reasons why these elderly people don't answer our calls. Perhaps they are not familiar with the number, and perhaps, well, because if the call is not answered, we'll leave a message in the voicemail, and perhaps they are not familiar with using the voicemail. So I appeal to the elderly population. If you are not well and if you're infected, and if you have made a report to the Center for Health Protection, you may receive a call from us about COVID treatment. And as mentioned by Dr. Au just now, the family members should do their level best to help, because elderly people may not be tech savvy, and they may feel quite weak after getting infected. So if necessary, please visit them more often and give them information and give them help, especially for elderly singletons. Perhaps you should find someone to look after them. And about the 27-month old boy, he's in stable condition, and he no longer required breathing support as of yesterday. In fact, he has been transferred out of ICU to the pediatric ward. And as for gene analysis, so far we know that the case is BA.2. As for the 5-year-old girl, she remains in critical condition, and she is now receiving intensive care in Tuen Mun Hospital.
As the expert advised, I don't have the information with me for the time being, but in general, in terms of vaccine pass, we really do want to make sure that when people are going into the mask-off venues, they would get the protection, and once they get infected, they should be able to mitigate against progression into serious cases. The scientific committee would make advice regarding the interval between shots and the quantities. Now, for those above 12 years of age, they should have 3 shots, and after the second shot, one can take the third shot after 3 months. The gentleman in the middle row, please. Doctors, TVB. I'd like to ask a question about the trend of COVID. The number has gone up to more than 5,000. Is it an upward trend? Do you think that we should tighten up on the existing measures? Dr. Al mentioned the situation, the vaccine coverage of those above the age of 60. It is not good enough. Are there any mandatory measures to make sure that people in this age bracket will be getting 3 shots? And Dr. Lau, about the utilization of hospital beds, the number of admissions has crept up of late, and today we're talking about close to 300 beds that will be utilized. How many more beds do you think will be deployed to cater for the senior citizens who are going to be admitted to hospital? And how do you relieve the burden on the hospital beds? Thank you for your question about the COVID trend. Starting from July, we are witnessing an upward trend. Over the past couple of weeks, the growth has subsided a little bit. However, over a longer period of time, we are looking at an upward trend. In July, we were looking at 3,000 to 3,005. By end of July or early August, we are looking at 4,005. And last week, the number stood at about 5,000. Today, it has gone up to 5,500. So we are looking at this upward trend consistently. So in the days to come, the number will be lingering around this level or higher. In particular, the proportion of BA.5 cases are on the rise, and there will be more transmission in the community. We will be monitoring the situation closely. The government would like to adopt a scientific and precise approach to control the virus, and we will suggest measures that will enable to achieve the control target with precision without having to tighten up the measures. I'm sure that the scientific committee and the government will look at the situation and make the recommendation. As to vaccines, we've always been encouraging the senior citizens to get vaccinated because once they get infected, like Dr. Lau said, the likelihood of severe cases or death would be high. The government has rolled out a whole raft of measures. We have stepped up the outreach service. We are liaising with the private sector, and the HA is organizing teams to administer vaccines in the care homes, and this has something to show for it. Over the recent past, the vaccine coverage in these care homes has increased significantly. In the community, there are still some senior citizens who are unvaccinated, and this is really something we are concerned about. We urge the senior citizens to get vaccinated as soon as possible. The CSB has already introduced this on-site vaccination of those above the age of 70 if they have mobility issue and cannot go to the vaccination centers. They can register this home vaccination program. All along, the demand for hospital beds has been increasing, and as I said earlier, we do have a high-level contingency command center to look at the 7 clusters and see how we can address this admission issue. We are talking about the first and second stages. In the second stage, we hope that we will be able to open up 2,500 beds to cater for the COVID patients. And we're almost there, but we anticipate that the number of COVID-positive cases might increase, involving senior citizens in particular. So we are making preparation for the third stage, which will cover 2,500 to 5,000 beds. We will not be rolling them out all in one go, like the 2,500 beds in the second stage. We do not open them up all in one go. As the admissions increase in number, we will be deploying the beds and make them available. And if we turn all the beds into COVID beds, then we still have to cater for the non-COVID patients, and they are undergoing a wide variety of treatments, including the emergency treatment and elective treatments. It's only in an inevitable situation that we would delay the elective services. So this will happen on a progressive basis. But we do have to make preparation. We have to plan everything in terms of manpower and logistics for this to happen. Next, please. Lady in front row on the right, please.
UTV News. And as there are more elderlies catching the virus in the community, does the government has any plan to provide further support to those elderly undergoing quarantine in the community, aside from asking them to get vaccinated? And if yes, how? And another question for the hospital authority. And as you are significantly increasing the number of hospital beds for COVID-19 patients, could you tell us, is there sufficient manpower to cater for the needs of so many patients, and is there a need to hiring part-time medical staff? And how would you balance the need of the non-COVID patients? And is there any plan to further curtail non-emergency services of the public hospitals? Thank you.
Thank you for your question. For the first question on the COVID infection among elderly living in the community, we have observed a significant increase in the absolute number of elderly persons aged 60 years or above infected with COVID in the past few weeks. According to the latest figures, in the past 2 weeks, there are over 15,000 elderly aged 16 years or above infected with COVID. So we encourage the elderly living in the community to receive vaccinations as soon as possible. And if they have symptoms, they must seek medical care or consultation, and also do testing so that if they are really infected, they can receive treatment as early as possible. And if they are tested positive, they must be reported to our online platform so that we know about the cases, and also we can pass the information to the hospital authority for follow-up on the treatment and also follow-up on their medical conditions. If persons they don't know how to report their results on our online platform, they can dial our hotline 183-6991, and our colleague will contact them to arrange to get more information and also to arrange isolation for them.
As there are increasing number of patients admitted to the hospital, especially for the elderly, we have to reserve the beds to accommodate them timely. How can we do it? We have to redistribute our manpower by adjusting the services, especially the non-essential services. That means the services to the patients that can be postponed for a bit late. Of course, we have to balance the manpower and the resources to the COVID and non-COVID patients. We have to maintain the emergency services. For example, for the patients with accident or acute heart attack or stroke, the patients can't wait, and we have to give the service, the treatment to the patients as soon as possible in the hospital. So we can't change all the beds to COVID patients. We have to maintain some degree, actually much the best for the non-COVID patients is more than the COVID patients at this moment. And at the same time, how can we maintain the services? We have to keep our staff free from infection or with little infection. We have regular testing to our staff, including the daily RAT, as well as for some staff who are working in the high-risk area, we have the PCR test twice a week.
Next question. This gentleman near to the right-hand side. I'm from Now TV. Good afternoon. Fei Chui Senior Elderly Home, is the nurse the source of infection? Where did the nurse get infected? Did she have frequent contact with residents? Another question for HA. In recent weeks, you have been referring patients to private doctors for treatment and consultation. How many patients have been transferred to private hospitals? What about patients not giving consent to the transfer? What is the reason? And before transferring these patients, what assessment would the HA make? And if a patient refuses to get transferred to a private hospital, what would be the arrangement? Will the patient stay in the HA hospital? For the first question about 翡翠長者之家, the first staff member who had contact with the patient is the nurse responsible for registration. As we understand, the nurse was mainly responsible for dispensing drugs and providing personal care. On the 13th of August, through compulsory testing, a specimen was taken from the nurse, and then on the 15th, the PCR test result was positive. She last attended work on the 14th of August. And on the 14th, in fact, her RAT result was negative. The CT value was around 32, 33. And then starting yesterday, we continued to receive reports from elderly residents and another staff member testing positive. For this nurse, we understand her to work on the first and the second floors, and we're now conducting investigation. She could be the source of infection, and yet there could be other silent cases in the home. At this moment, let me check. As of 5 p.m. on the 16th, 105 patients were receiving care in private hospitals. 15 have been sent to the Chinese University of Hong Kong Medical Center, and they are now receiving treatment because of COVID infections. And every day, well, for the TMHK facility, they receive COVID patients referred by us. Basically, we would pick patients not requiring essential treatment, patients in the recovery phase to be transferred. And we are grateful to private hospitals for discussing with us on the criteria for accepting these patients. And in fact, they have continued to relax the criteria, and we hope that more patients can receive treatments in the private hospitals so as to alleviate our pressure. Indeed, when we talk to some patients about the transfer, some patients may refuse our referral because of the hospital's location, because of concern about private hospitals' affairs and charges. And once again, I would like to explain to our citizens that if upon our assessment you are suitable to be transferred to a private hospital for further treatment, in the present circumstances, you're not required to pay additional charges. You're only required to pay the standard public hospital rate. We urge patients to be cooperative because every hospital bed in our facility is in high demand. If we're able to release more beds to take in more patients, be they COVID patients or otherwise, we can also redeploy manpower, which is now another reporter asked about our manpower. And indeed, some of our staff members have either been infected or been listed as close contacts, and that means our staff members would need to work extra hours, so they had to walk the extra mile as well. We would like the private hospitals to make available more beds to take in our patients as well. Next question. Good afternoon, I'm from AM 730. About the elderly home, as mentioned, called the Jade Elderly Home. How did a staff member come into contact with residents there? And about the day-to-day operations, would residents only stay on their own respective floors, or would there be cross-floor infection? And about the vaccination coverage, you said that there is more to be decided for the elderly population. So what is the desired coverage? And for those not requiring the third shots, do you take them into account? Because otherwise, you would never reach a very high percentage. And about the cancer patient who passed away without any vaccination record, did he have any medical waiver certificates? Are there many such waivers given? Do you have a percentage or a number of patients receiving such medical waivers? Thank you for your questions. About Jade Elderly Home, in your first question, we received the report of the staff testing positive via PCR yesterday. The results came to us yesterday. The patient was asymptomatic. This patient was a carer. The carer would come into contact with patients as she fed them, but she worked on the second, fourth, and fifth floor. The first staff member worked on the first floor. As we understand, these two staff members did not have meals together. They were not close contacts. In the facility, comprising 5 floors, on the first, second, and fourth, and the fifth floors, we have recorded infections, and these are locations where these two staff members would go to for their duties, and we don't rule out nosocomial infections. As for residents, usually the residents would stay on their own floors. Each resident lives in their own respective cubicles or partitions. It's not fully enclosed, and therefore we believe that there is a chance that other residents may be infected, and we have therefore arranged for all residents to be quarantined.
Second, about the vaccine coverage. I mentioned a moment ago that for senior citizens, I gave you the figures for those with 3 shots. According to a scientific committee, those above the age of 60, they are supposed to have 4 shots to be adequately protected. Even if they are infected, then the senior citizens should have 3 shots. For those between 60 and 69, the proportion is 70% for those with 3 shots. And there is a bit of a gap from the ordinary citizens. For those above 80, only 44% have had 3 shots, which is really on the low side. I'm sure in the community out there are many citizens, senior citizens, who are not adequately protected. We hope that every senior citizen would get the shot in order to guard against any risk of severe cases and fatality. As to the vaccine exemption, I don't have the information with me. Now, for this 52-year-old female, whether she had any vaccine exemption before she passed away, I don't have the information. There are not many cases that have the vaccine exemption. Now, many of the chronically ill patients, I'm not sure about this one, but in general, for a cancer patient undergoing chemotherapy, this is no reason for any exemption from the COVID shots. It is precisely this reason that they need to have the inoculation. So please, I would like to debunk the myth that for those who are chronically ill, who are suffering from severe illnesses, they should not get the shot. Now, for the patients undergoing chemotherapy, if they get infected, they are most likely to progress into severe cases, and the vaccine will give them the best protection. The other thing is the medication. If someone is positive, one should seek medical attention and get the medication. As I said, one can make an appointment at the designated clinic, or one can log on to the HA Go to make an appointment for telemedicine. If you feel helpless, other than the number given by Dr. Ao, the HA has also another hotline, 1-836-115, 1-836-115. You can call this hotline with your inquiries, and you will be given assistance to make an appointment with the designated clinic or the telemedicine. If you feel helpless, all you need to do is to pick up the phone and ring 1-836-115. Lady at the back, please. Economic Times. This month, 15,400 senior citizen COVID positive cases. What is the vaccine coverage among these people? How many were hospitalized? How many are symptomatic? What are their conditions upon admission to hospital? And what subvariant did they suffer from? And how many of them were prescribed the antivirals? Now, the senior citizens are mostly from the community, and Is it the case that the old folks' homes had many clusters? That's why they enjoy the immunity. Now, what is the vaccine coverage for the care homes? And for imported cases, now you said that most of the cases have pretty low viral load. How many of them have really high viral load? If I may take some of the questions first. Right now, in the community, the number of senior citizens who get infected is creeping up. I don't have the number regarding the vaccination. And I don't believe that the number is too high. For the subvariants, the Public Health Service of the CHP is random checking. About 24.5% of the cases are L452R, presumably BA5, and 78% are BA.2.12.1 cases. For the senior citizens who are living in the community, the distribution and the proportion of the subvariants that they come down with should be consistent with the trend. So for senior citizens, of the cases we have conducted genome sequencing for BA5, 10% are between 60 and 69, and 3% are over the age of 80, and 5% are from 70 to 79. The other question is about the senior citizens in the care homes. In the fifth wave, or towards the end of February or early March, the situation was pretty severe in the care homes. 70% of the senior citizens there came down with COVID, and the government has really rolled out the vaccination program for the care homes. And the vaccine coverage for the care homes is really good enough. For those above the age of 80, the proportion is not at a high level in terms of vaccination. However, senior citizens in the community do not enjoy good enough protection. And during the fifth wave, a lot of them were not infected, or they were unvaccinated. So in this surge of cases, if they are infected, it is likely that they will need to be hospitalized, or they will develop severe cases. For the antivirals, and let me give you some stats. As at August 16th, we have prescribed 1,100 or so antivirals for these patients. 50% were prescribed by the private practitioners, and the others were prescribed at the A&E, designated clinics, the ward, and telemedicine. 300 or so patients were prescribed antivirals through the telemedicine. Now, the coverage is not all about 60-year-olds. A quarter are 60-year-olds, and they are 1,200 or so. So we have 170 admitted to hospital. We definitely would prescribe the antivirals. For those who haven't been prescribed the antivirals, we would bring them up. Those above 60 years of age, if they declare their result, we would bring them up individually, or we make an appointment for them to have a medical appointment. As I said, some will never pick up the phone. I'd like to make a plea here. Please do pick up the phone if we call, and please turn up for medical appointment. Some would miss the appointment And we're also worried that they may not be taking the medication prescribed, so they have to take the medication, and family members should give assistance to make the appointment and to make sure that they take the medicine. If their conditions deteriorate, they should be taken to the doctor or the A&E. The message I'm trying to hammer home is we have more senior citizens who get infected, who get hospitalized, and the fatalities, severe cases, are also increasing. So we have to be advised this to make sure that the senior citizens would not be suffering so much, and so that the healthcare system will not be overburdened. One should get vaccinated, report the cases, take the medication appropriately, and go to the doctor, and when necessary, turn up at the A&E. Now, all these are intended to make sure that the message will sink in. We should look after the senior citizens to guard against the possibility of developing severe cases.
Last question for today's press briefing. I'm from Ming Pao. Good afternoon. First, relating to Dr. Lau's statement that there are more severe cases belonging to the age group above 60 requiring hospitalization. Can you explain more? What about the total number of cases age 60 or above vis-a-vis the total percentage? And because other than inoculation, are there other factors at play, such as the Omicron strain? And after hospitalization, usually how many days a patient would stay in hospital? Dr. Lau just mentioned longer period of stay in the hospital, and do you have the relevant figures? How many patients are admitted because of COVID, and how many patients admitted because of their own conditions? In light of the increase in the number of elderly inpatients, is there a situation where the residential care homes refuse to take back their patients after being discharged from hospitals? And also, when the threshold is reached, then the Asia World Expo facility will be recommissioned. Are we facing this situation? And about Jade Elderly Home in Southern District, can you tell us more about other residents who haven't been vaccinated? Thank you for your questions. About infections of elderly people in the community, we notice an increase in terms of absolute number of confirmed cases. And comparing to 1 or 2 months ago, the number of infected elderly has also increased, mostly due to the overall situation in the community. We have more transmissions in the community, leading to an increase in the number of confirmed cases, as well as a high risk of elderly getting infected. Another reason is that in the fifth wave, some elderly people had stayed at home without going out, and previously they had not been infected. But now, with more social activities because of relaxed social distancing measures, they might have a high chance of getting infected. So for elderly people who are unvaccinated, they face a higher risk of infection in the community. And this also correlates to an increase in the number of elderly cases being admitted to hospitals. About Jade Elderly Home, according to the information at hand, for residents who've been doubly jabbed, the coverage is 93.2%. For those triply jabbed, only 44.3% of total. We don't see a substantial increase in the number of cases turning severe, basically some 40 to 50 cases per day. However, among the severe cases, 80% of these patients are 60 years of age or above. That means if you're above the age of 60, if you're admitted, you have a high chance of having a severe condition comparing to the younger age. And apart from that, there is also a very rapid surge in hospital admissions for this age group. We must understand that if a patient is prescribed with antivirals, then they may be effectively treated and they may not require hospitalization. Some patients may have underlying conditions. They may be cancer patients, and in fact, in one of the death cases reported today, because of OPG found in both lungs upon examination, the patient was admitted to hospital and intubation was needed, and the patient had pneumonia. And that is why we're trying to explain to the public that the situation is dire. We need to protect our elderly. We'd like to protect the two major groups in our population, namely elderly as well as our children, against COVID. Apart from vaccination, early prescription of medication, if need be, family members should help them, and they should also seek help by reaching out to us via the hotline and reaching out to their family members. As for number of days in hospital, on average is 7 to 8 days, but that's just an average figure, covering patients in all age groups. However, for elderly patients in particular, they tend to stay in hospitals longer, mainly due to their own condition. They may need more time to recover, and also they need more time to clear the virus out of their system before they can be discharged. And as mentioned by Dr. Au, many elderly patients have not received enough jabs. Some of them had no jab at all, and some of them had only 2 jabs. And if you do not complete the vaccination regime, the 3-dose regime, it may take longer for virus to be cleared out of your system. So for elderly patients, as we understand, sometimes they may need to stay for 2 weeks in hospital. Recommissioning Asia World Expo, the facility, we strive to make available more hospital beds to take COVID patients, because if we are to recommission the Asia World Expo facility, we need to redeploy manpower from hospital authority to help out there, and that means less manpower for our own facility. So we are trying our best to handle these cases in our own system by making available more beds, and at the same time, recommissioning Asia World Expo facility is definitely one of the options in our Phase 3 plan. It's now on standby. Within 48 to 72 hours, we should be able to recommission the facility to take COVID patients. We need to consider all the resources as a whole. Apart from the facility receiving patients in the Hong Kong Infection Control Center, we also need to consider the capacity. And meanwhile, some patients can be referred to private hospitals. So we need to check out the number of patients in private hospitals, in the holding centers for elderly, etc. There is a basket of factors affecting our hospital bed deployment, which would affect recommissioning the Asia World Expo. That's the end of the press briefing. Thank you.